నా పేరు అనసూయాదేవి అండి. హిమాయత్ నగర్ నుంచి వచ్చామండి. కాలు కొంచెం నొప్పి ఎక్కువగా ఉందండి. 2-3 సంవత్సరాల నుంచి నొప్పి ఎక్కువగా ఉంది. డాక్టర్ దగ్గరికి వచ్చామండి. తెలిసిన వాళ్ళు ఉంటే వాళ్ళని పట్టుకొని డాక్టర్ దగ్గరికి వచ్చామండి. మమ్మల్ని బాగానే చూశారండి. ట్రీట్మెంట్ కూడా అండి బాగానే చేశారు. ఆపరేషన్ కూడా బాగానే చేశారండి. 1 నెలలోపే కోలుకున్నానండి నేను.
Hi, this is Dr. Sukesh Rao Sankineani, consultant shoulder surgery, arthroscopy and joint replacement, Yashoda Hospitals Secunderabad. Today we'll be discussing about an interesting case of Mrs. Anasuya Devi, who came to us with complaints of pain in the knee and inability to walk. On evaluation, we found that she was suffering from severe joint arthritis of the left knee, and we also found that there was abnormal mobility in her shin bone. We evaluated her and found that it was due to a fracture that was long-standing in nature. It is basically due to unmanaged osteoarthritis leading to stress fracture of the shin. Normally in such procedures, we do it in a staged way, that is first fix the fracture and then do a replacement. But since we had the expertise of Dr. Brijesh Kidiyor, who is our trauma surgeon, the patient is now 4 months post-operative. She is ambulatory, she is doing her works independently. She and her son are very happy with the outcomes. Hope that she leads a very independent life, which is required from every patient. Thank you.
I'm Dr. Brijesh. I work as a trauma surgeon, orthopedic consultant at Yashoda Hospitals Secunderabad. So we are discussing an interesting case here where one elderly lady, Mrs. Anasuya, on careful examination, we noticed that she had 2 issues. One was she had an age-related degeneration, what is known as arthritis of the knee. The knee joint had a fracture which was unnoticed. So she had a non-union or a fracture which has not healed of the leg bone and arthritis in the knee above that. So me and my colleague Dr. Sukesh, we decided to treat this in a combined approach, in the sense there were 2 problems here. One is the arthritis of the knee, for which the solution is a replacement, and the non-union or the fracture which had not healed till now since 4 years. So we had to fix the fracture as well. We decided to plan and go ahead with a combination procedure where we do a replacement and at the same time we fix the bone and address the unhealed fracture as well. Usually when we do a procedure for a long-standing fracture which is not healed, we do something called as a bone graft. But for us the advantage here was that the cuts or the bone pieces which we had removed from the replacement surgery, we have used that as a bone graft. So we didn't have to do any additional procedure as such, in the sense do bone grafting from a different process or different part of the body. So once we had done the fixation of the leg or the fracture, which was stabilized and grafted, we went ahead and did the definitive fixation of the knee. In the sense, we replaced the knee and fixed the fracture as well. After fixing the fracture, we've closed the wound and got a reasonable amount of healing, which went on as expected uneventfully. She went through the entire process of wound healing without any infection or any delayed wound healing of that sort. Immediately, we have started her on the movements of the knee, which was previously not possible because either movement was occurring at the fracture site, which was painful, and the other thing was the arthritic knee was not allowing too much of movement. So we addressed the movement part with the replacement and the fracture fixation. Post that, we allowed her to heal for about 6 weeks. After 6 weeks, we have given her some kind of support in the sense of with a walker, and we've made her walk. So as of now, she is doing very well. And since 4 years, she was unable to bear weight or unable to walk on that leg. So now she is comfortably doing that. She didn't have movement in the knee. So she's got good movement in the knee, and most importantly, she is independent and she is pain-free. So me and Dr. Sukesh decided to do a combined approach, and usually in such complex procedures, 2 surgeons working together with 2 minds for the benefit of the patient helps. So I wish Mrs. Anasuya all the best, and let's hope that she has a pain-free future.